A professional needs to clear a specific regulatory threshold to transport critical patients and manage emergencies in a moving ambulance. To cut hair and shave faces, they face a different set of requirements. To become an entry-level emergency medical technician, the national baseline requirement is roughly 36 days of training. Training requirements for licensed barbers follow a different trajectory. All 51 U.S. jurisdictions mandate formal education before holding clippers for pay. The national average is about 1,230 hours. California sets a high bar at nearly 1,500 hours, while New Hampshire enforces a 1,000-hour minimum. These mandates originated in 1897. Lawmakers established these barriers to control bacterial skin infections, like impetigo, in an era of limited professional hygiene. Basic infection control is still a necessary component of personal service industries. Sterilizing equipment and maintaining clean facilities are standard baseline practices. Analyzing cross-state data reveals a structural disconnect between mandated hours and safety outcomes. The empirical evidence suggests the current training architecture acts as an artificial labor supply constraint. State licensing boards maintain that high-hour licensure requirements are necessary to protect consumer health and safety. To test this, a 2025 Institute for Justice study titled Clean Cut analyzed over 3,000 health inspections across jurisdictions with varying regulatory demands. This chart compares inspection outcomes between Alabama, a lower stringency model, and Mississippi, which enforces a more demanding framework. Despite the difference in training, both states clear a 95% pass rate. The strictness of the requirement has no measurable impact on safety outcomes. The data isolates the drivers of safety. Targeted interventions like chemical sterilization and hand hygiene mandates prevent infections. Cumulative training hours do not. Requiring 1,500 hours instead of 1,000 yields no statistically observable improvement in public health. The link between these hourly quotas and consumer safety is severed by the evidence. Since the public health justification is unsupported, the focus shifts to the economic impact. These quotas create a financial barrier before a barber earns a single dollar. The direct capital output begins with the national average vocational tuition, which is $14,546. Tuition is only a portion of the total cost. Completing 1,500 hours requires 37.5 weeks of full-time, uncompensated study, which introduces a significant opportunity cost. Based on median wages in the sector, that foregone time equates to nearly $40,000 in lost earnings. Students absorb this capital deficit to enter an occupation where the BLS reports a median wage of $18.73 per hour. For lower-income entrants taking out federal loans, the ratio between entry debt and expected income creates immediate financial instability. We see this stress in the data. Certain training programs report a 30% cohort default rate on student loans, which places these institutions at risk of violating federal gainful employment regulations. The 1,500-hour architecture operates as a regressive economic tax. It generates financial friction and elevated default risks out of proportion to the occupation's baseline earning potential. This regulatory friction impacts an expanding labor market. The barbershop industry generates $7 billion in revenue and is projected for 5% employment growth. Meeting that demand requires a steady influx of new practitioners. High capital costs and arbitrary time commitments build an artificial bottleneck, restricting the labor supply available to meet this demand. Recognizing this, state legislatures are beginning to recalibrate. Kentucky House Bill 273, proposed in 2026, aims to reduce the state requirement from 1,500 to 1,200 hours. This 20% reduction is a deliberate effort to remove unnecessary barriers, lower the cost of entry, and increase workforce mobility. A 2025 National Bureau of Economic Research working paper illustrates this effect in the analogous cosmetology sector. It shows that lowering the required hours directly reduces tuition and increases enrollment. Reducing mandated hours mathematically lowers the financial barrier and expands market participation without exerting detectable downward pressure on practitioner wages. As lawmakers attempt to fix these supply constraints, they are operating with a structural flaw in their data. There is a widely debated hypothesis suggesting that fewer than 40% of licensed professionals in this sector actually use their license for primary income. Proving or disproving that number is currently impossible because tracking systems are disjointed. State licensing boards collect zero data on actual employment. They only track fee compliance and renewals. The Bureau of Labor Statistics counts employed wage workers, but ignores the ecosystem of self-employed entities, including over 130,000 non-employer operations. With hundreds of thousands of independent contractors missing from the primary federal surveys, we cannot mathematically verify how many licensees are actually working. Until state license files are cross-referenced with federal tax records, workforce policy in this $7 billion market operates in an empirical blind spot. The industry faces a modern labor market constrained by an archaic barrier to entry, even as technological efficiencies attempt to offset the friction. Digital modes are already sorting erratic schedules into clean timelines. Modern software can easily automate client management and booking, but it cannot replace the skilled physical labor required to deliver the service. That output relies on human supply. Because the core service relies on human supply, the 1,500-hour barrier persists as a function of historical protectionism. Lawmakers must execute 3 specific directives to modernize this framework. First, align occupational training hours strictly with empirical skill acquisition, capping state requirements between 1,000 and 1,200 hours. Second, decouple safety protocols from upfront hour quotas. Instead, mandate ongoing continuing education focused on modern infection control. Finally, commission federal and state data sharing architectures to accurately track and measure actual workforce utilization. Optimizing this sector requires abandoning century-old assumptions and replacing them with an evidence-based, mathematically sound regulatory framework.